Breast augmentation is a surgical procedure where an implant is placed into the breast area. Some are placed above the muscle and others are placed below the muscle. There's two types of implants. One is saline and the other is the cohesive gel implants. So in the United States, there are actually two types of implants that are FDA approved. First is the saline implant, which uses salt water as the source of giving volume, and the other is actually a cohesive gel implant, hence the term gummy bear. The gummy bear has now different levels of gumminess, one that is very soft and progressively getting a little bit firmer, and it's each individual that gets examined and during the consultation is given recommendations for that specific type of implant. Usually after the breast augmentation procedure, I usually recommend patients for them to stay home and kind of not do any significant physical activity for about a week. After a week, they can drive as long as they're not taking any narcotics, and usually they can go back to the gym in 3 to 4 weeks. Breast implants can be redone. It all really depends on the specific need for the revision. Most common procedure is where a saline implant that was used in the past is now converted to a cohesive gel implant. But if patients are unhappy with the size or the shape, breast implant revision surgeries are quite common. Breastfeeding ability with breast augmentation is definitely dependent on the surgical procedure. So if a patient has a history of breastfeeding a child, the patient can maintain that breastfeeding ability by choosing an incision under the breast fold for future children to be breastfed. Breast augmentation has different incision approaches to place the implant. The axillary and the fold incision is more commonly used if somebody wants to truly maintain their breastfeeding ability 100%. The periareolar incision is chosen at times to give you a better shape or better manipulation of the pocket, but that does decrease the ability to breastfeed in the future. Breast augmentation procedure is a very individual procedure. Choosing a board-certified plastic surgeon is very important when choosing to do a surgical procedure. Patients should look at the before and afters, but it's very important to come in for an actual consultation with the physician, more so than basing it on before and after pictures, although they are quite important when you're determining your comfort level in choosing your surgeon. So I tell patients once they've had their breast augmentation surgery and they're very, very happy, they don't really necessarily have to change their implants. Usually I recommend changing the implants if they have a problem, such as if they had a saline implant and it's deflated or it's kind of sinking or becoming smaller in size. Second is if they feel like the implant after a traumatic event such as a car accident, I usually say we'll get an MRI and let's take a look at the integrity of the implant, and if there is a compromise then we should change it. But there's no specific 10-year rule that it needs to be replaced.